Congratulations and welcome to the office. Your decision to do your home care exercises and purchase the home care equipment is one of the best decisions you've ever made in your life. Here's the reason why. Because subluxation, like we spoke about in reported findings, is one of the most detrimental things that can happen to a person right here. Your commitment to do these exercises is going to increase the time with which we correct your subluxations, and it's also going to give us a better postural corrections, reducing spinal cord tension, really increasing the health and the function of your body. And the benefit of that is not only reducing your pain, but allowing your body to function better, to have less disease, to increase health to where your medications become unnecessary. And we see that happen every day in the office. So spinal correction consists of two parts. The first part is coming in, getting adjusted. Or actually, when you come in, you're going to do your warm-up exercises. Then I'm going to give you specific exercises based on your x-rays right here. And then after that, we're going to do some exercises in the office to lock down the change. The second part of that, and this is an irreplaceable part of that to get spinal correction, is you need to do your home care exercises. If you're watching this video, it usually means that you purchased the home care kit and that I've recommended a set of exercises for you to do on a consistent basis. Why do they have to be consistent? When I say consistent, I mean every single day. There's two types of muscle fibers in your body. There's type 2, which are like your biceps and your hamstrings. You can exercise these 2 or 3 times a week, develop strength and size. But your type 1 muscle fibers are your postural muscle fibers. These are the ones that hold the spine in place, hold the posture in place. These muscle fibers need to be constantly exercised, consistently. In fact, the research says if you don't exercise these muscles, they can lose 50% of their strength in one day. If you don't exercise them for 2 days, they can lose 70% of the strength. And so when we tell you need to exercise these muscles every day, it's every day because that's what the research says. Now these exercises you're going to do, they're going to be real simple, they're not going to take long, but they are going to really determine the amount of spinal correction you get in your spine. Okay? So make sure you do this. For most people, it's going to be about 90 days. What we're going to do for the first 90 days, your exercises twice a day. Why twice a day? The research says people who do the exercises twice a day get bigger, better changes than people who do the exercises once a day. After those 90 days, we'll cut you down, for most people, doing your exercises once a day. Okay? And then we have maintenance. It's really the power of chiropractic, the beauty of chiropractic comes in when people are under maintenance care. They talk about, Doc, I haven't had an infection since I've been seeing you. I haven't had a cold. I used to get 3 or 4 colds a year. I haven't had a headache. I don't need this medication anymore since I've been getting under care and since I've been making the changes in my life. And that's what I want for you in the same way I want for my family and everybody, is that kind of correction. Lastly, maintenance care for some people will consist of doing your exercises once a week. Other people it might be every day. But we're going to highly recommend that you do these exercises on a regular basis to keep the correction that you had and that you get the beauty of having a healthy posture, a healthy spine, a healthy nervous system, which translates into the greatest potential for optimal function in your life right here. If you have any questions on the videos, if you have any question on your exercises, please don't hesitate to give us a call, send us an email, or talk to me on your next office visit. Okay? Looking forward to seeing you and getting great spinal correction for you and your entire family and anybody you know. Thank you.